Hi everyone, welcome to the webinar. My name is Erin Maguire. You'll see on this first slide that I've listed a couple of different titles that I hold. One of them is Director of Student Support Services for the Essex Westford School District. I also serve as the President-elect for the Council of Administrators of Special Education. That's the national organization for special education directors. And while those are my titles, I also play a significant role in pre-kindergarten in my school district. I am a person who oversees a lot of the work around pre-K as well as early childhood special education, and so hope to bring some expertise to the table to talk with you a little bit today about the universal pre-kindergarten under Act 166 that's available in our state, give you a little bit of an update, and talk with you further about your own questions around this topic. I've developed this presentation as best I could, given it is a webinar and not necessarily sure exactly who my audience is. And so if you wouldn't mind to go ahead and ask me questions throughout the presentation to make sure that I'm able to tailor it to your needs, that would be great. I'm going to make sure to get your questions answered. And if the presentation materials that you see as we go through don't meet those needs, please don't hesitate to let me know that. Ask me questions about other topics if you have them, and then I'll do my best to answer those or maybe provide you follow-up resources. So let's get started. As soon as I can move this slide forward, we will do that. There we go. Sorry about that. Okay, so as you probably read in the precursor to this webinar, this is an update around the state of Vermont's investment in pre-kindergarten education. I'll talk a little bit about the reason for investment and an update on the current statewide circumstances around implementation of Act 166, but the main purpose of today's webinar is to share a little bit with you from someone who is responsible for the private-public partnerships between private providers of pre-kindergarten and early care and learning in the state of Vermont and the school districts. That relationship has developed over time from a number of different perspectives and has developed differently across the state. And while I'm in Chittenden County, there may be certain ways that that's developed there. I will also be able to speak some to other areas of the state and recognize the variation, but help you understand the consistency of implementation of Act 166 implementation across the state. And I'm hopeful that there are providers here and maybe parents and other maybe public school folks who will ask questions specific to your context to make sure that I address those. So, sorry about the PowerPoint. It seems to have transitioned a little oddly. The N should go at the end of pre-kindergarten, not on the next line. The value of pre-kindergarten is really clear, and I wanted to make that statement up front, and I'll provide you a little bit of resources around that, but the state of Vermont has implemented universal pre-K because what we know is that there is very significant benefit to children as well as our communities as high quality pre-kindergarten is implemented. It's not just pre-kindergarten, but actually quality pre-kindergarten in the research that shows that impact both around kindergarten readiness and long-term impact to young children. And so Vermont has invested in pre-kindergarten tens of millions of dollars from public funds to provide universal access. We'll talk about how that has come forward, and there's still work to do, particularly around equity in access, but we're getting there and we're continuing to work around that. And then also recognizing, I think, what is a benefit in Vermont of really blending the private provider community with the public offering of education to try to make sure that we are available to all children. We're going to talk a little bit more about that as we go forward. The other piece that I just wanted to mention was that the investment itself is really significant and has changed the budgets for school districts around the state. The increase is very, very present in all school district budgets. And if you have more questions about your local context for impact of how much has been implemented and dedicated to pre-kindergarten in your local school district, you can likely find that on their websites and take a look at the budget. There should be a budget line that you can actually see the investments in pre-K, particularly under Act 166. I did want to just note that a task force that was created by the nonprofit Brookings Institute in combination with Duke University's Center for Child and Family Policy completed a recent study. I believe this was in 2017. And their final finding was that, in conclusion, after everything they looked at, that the scientific rationale really does uniformly provide positive evidence on the impact of kindergarten readiness and long-term impacts around inquiry and impact, leading to a conclusion that scaling up high-quality pre-K is in the best interest of children and of our communities. And so that's the research that helped Act 166 move forward. I did also want to share, though, that Act 166 seems to be changing the face of the provision, the availability of early care and education in our state. So I'm going to get into the details around how Act 166 plays out, both financially as well as enrollment processes, the legal implications, and that's later on in the presentation. But one of the main pieces that I think is really important to share is that with Act 166 and providing access to slots in private providers through public funds has done is it has really pressed on the private early childhood and care community to change the way in which they provide pre-kindergarten. It has put very specific requirements around legal, licensing, and quality standards that I think are worth noting. And whether or not that's directly resulting in the chart you see in front of you or not, I'm not sure. However, what we are seeing between 2015 and 2018, which is a good chunk of time where Act 166 was really fully implemented across the state, we've seen a decline in the number of home-based care providers to a pretty significant level. There are 204 fewer home care providers than there were in 2015. As of 2018, it's declined by about 26.6%. And the number of slots available in home-based care has decreased by 1,854 across the state. Centers, there are also 20 fewer centers and fewer slots in those centers. School districts have increased by about 269 slots since then, but you can see that overall we are seeing right now a decrease in the number of available slots for children to be cared for in our state. That's an important data point to think about. It certainly was not the intention of Act 166 to have a decrease in available child care and early childhood education during this time. And so again, the factor, I cannot tell you exactly what factors are causing that specifically, although I would encourage you to think about that issue as you continue to consume this presentation and get maybe into conversations with each other and be thinking about this issue, because what we know is that having available high quality pre-K is necessary for universal public pre-K to be available. So I just want to talk a little bit about what universal means. So we said that we would provide universal pre-K available to 3- and 4-year-olds across the state of Vermont. We said that they would have access to high quality pre-kindergarten to the tune of 10 hours a week. That is fantastic in its concept. but there are some logistical pieces that I think I would offer have been a little challenging in making sure that all children have access to 10 hours of high quality pre-K a week. Now, keep in mind, those 10 hours are supposed to be free to parents. They must be, actually, under the law. And so if you think about the way we live our lives, figuring out how to access that 10 hours is something that I think is worthwhile just reviewing. So reminder that the circumstances for working families are very different depending on the situation for each family. But there are a number of families, I believe the last statistic I read was that 70% of Vermonters have both parents are either single parent homes where the parent is working, or both parents who are in the home are working. And so when you think about the role of working families as it connects to access to universal pre-K at 10 hours a week, there needs to be the availability of early care and education, not just pre-kindergarten. So we need care for children in order to support working families. Now, the concept behind universal pre-K was that those would be able to be paired, that we would be able to see children accessing the 10 hours of pre-K paired with whatever other provision of care would be provided for that child. The reality of being able to access 10 hours in a center and then figure out how to do that other 10 hours if you cannot afford that particular center's cost is challenging. The ability for families to access the full complement of services when a provider may only be willing to give a full-time slot that they can't afford is something that we are watching come up. And we're also watching the challenge of accessing early childhood special education for children who are experiencing developmental delays come up as an issue as well. Because we have some of these issues does not mean, at least from my perspective, that we've taken the wrong step forward. I do think that universal access to high quality pre-kindergarten at 10 hours a week is a much better frame of reference than not providing any under the law. And to invest in our young children in the state of Vermont, from my perspective, I really applaud that concept. We have some work to do in thinking about the meaning of universal access, where there are places that we might be seeing some families find barriers to accessing what we're describing as universal. That work is worth doing, and it's worth continuing the conversation from my perspective. Again, I can only speak for me, but I would offer that perspective. And I think what it takes is really working collectively together. Home providers, center providers, families, school district, the agencies at the state level. That's all worth a conversation in order to get to true access for all children to be able to talk about universal in that way. I also wanted to talk a little bit about the meaning of high quality so that you have a perspective about that as well as we dive into the details of how this all works. So when we talk about staffing, curriculum, and environment, those are all components that are specifically required when we talk about high quality providers. In meeting the definitions of high quality under Act 166, there need to be licensed teachers. Professional development is very important. Making sure that teachers, as well as all other adults who are working with children in these environments, have appropriate background checks, and that there is a safety aspect to make sure that the people who are with children are safe. There is also an expectation that there is a standards-based curriculum, and I we'll mention later the Vermont Early Learning Standards, which are the standards that the Agency of Education puts out for programs to attach to know what's important to teach and when to teach it. And then also we think about the importance of planning for instruction. The environments of early care and education settings and pre-kindergartens that meet high quality incorporate the importance of meeting licensure requirements. There are quality ratings, and we'll talk a little bit more about that as well as we get into the law around how the law recognizes quality from those quality ratings, the STARS system, NACE accreditation, and then also ongoing assessment and accountability inside of policy to make sure that those are all really present in high quality providers' environments. It's also worth noting that the meaning of high quality does not change between a home care provider, a center-based provider, or a school-based provider. So there are different ways that Vermont offers pre-K. We offer it in the public setting. We offer it in the private setting. Different communities have different sort of constellations of types of services available for pre-kindergarten. It's not sort of designed to be a one-size-fits-all model, and I think that's wonderful, but there are some expectations that are consistent across all of those different environments that are in place under the law, and so I thought that it would be worthwhile just to briefly review those. So today I wanted to note some of the spaces that I'll be going into in a little more depth. I'm going to talk a little bit about the logistics of partnership. I'll talk a little bit about pre-qualification, what that is and why it's present in the process. We'll talk about professional licensure expectations. We'll talk about the interactions of policies, both between and among the public school districts and the private providers, as well as state policy. We're going to talk a little bit about the expectations regarding licensing violations, as well as talking about any changes in status that happen in private providers, as well as public providers, and then instruction, and we'll round that out with instruction and assessment. I would like to offer an opportunity at this time, before I dive into some of these logistical pieces and talk about that, to see if there are any questions about anything that I've described so far. So we just did a little bit of an overview around where we find ourselves today around Act 166 implementation. We talked about what it means to be universally accessible. We talked about high quality. We talked about the decline in the number of providers in the state right now. And so we are going to just take a moment to let you think. So let me just give you a little think time, and would appreciate at this point, before we dive onto some of these issues, any questions or anything that you're not seeing in front of you that you were hoping to hear about today. So I'm just going to give a little bit of wait time. Okay, so I have a couple of questions that I'd like to try to answer. The first one is in reference to some of Secretary French's comments about some challenges with the delivery model in reference to Act 166 and pre-kindergarten. So I certainly cannot speak for the secretary at all. And I will tell you that I have not had a direct conversation with him about this, but I certainly am involved in conversations about some of the challenges with implementation of Act 166. The first thing I will share is that I think there are some real challenges with leading such a significant change in the state of Vermont in reference to implementing full universal access of high quality pre-K through two different agencies. So the Agency of Education and the Agency of Human Resources both have leadership responsibilities associated with this topic. And I think that's been challenging. I think that's been pretty widely known, and I don't feel like that is necessarily news, but I do think that that's part of why we've struggled. I also think that the conversation that I was having earlier about it being universally accessible and some of the barriers that I had talked about earlier are part of this conversation. So we haven't yet found a solution to some of the equity issues that are present. Right now, what we have is we have a statewide choice system associated with pre-K. So all parents have access to any pre-qualified provider that they choose to access. And the school districts need to partner with whichever pre-kindergartens are pre-qualified, and we're going to talk a little bit about what that means, in order to provide the universal access. So because of that, that means that parents can access pre-kindergarten where they work, regardless of how far it is away from their home and where they live. And that can be a very big benefit. But then there's also a question for, I think, all of us about what that means for accessing, for example, special education services in your home district, and what kind of conflict that puts us into. I think I would submit that that's an issue that needs to be resolved. We haven't resolved it, and I think we've really struggled to figure out how to move forward with that issue. I also think that we've struggled to figure out how to make 10 hours available when a lot of providers need you to be full-time and parents can't afford the other 30 hours of the slot. So there are some issues there from an equity perspective. There are also challenges around the logistics of partnership and managing the paperwork and the duplication of effort. I'll talk a little bit about that as well. So when there is a conversation that there is a fair amount of chaos, I think the word is, that got used in some of the articles, there are challenges. And so I do think that we have a responsibility to do better. And I think that that is the comment that Secretary French made. And I do think that's true. But I am submitting that we shouldn't necessarily fully scrap the whole entire system of accessing high quality pre-K. Maybe we need to make some changes to the system as it exists right now, but there is a fair amount of challenge that needs to be addressed. So I hope that that helps address that question in reference to Secretary French's comments. There's another question. Do you see any major changes in Act 166 coming forward? I will share with you that I know that Act 166 and universal pre-K is a conversation that is had pretty regularly at the State House with our lawmakers in Vermont. There is a significant awareness, as you just heard me talk about Secretary French's perspectives about where we find ourselves, that there is a need to do better. And so I don't have any information specifically that we will see any particular change, but if I had an opportunity to provide recommendations for change, you'll hear them sprinkled throughout this presentation, and I've just hit on a couple of them. One is about the number of slots that are decreasing in Vermont and why that's happening and what's happening and how does Act 166 play a role in that, because we need high quality slots for as many kids as we can if we're going to hit this benchmark of universal access to high quality pre-K. I also think we need to talk about the equity issues. I think it is very important that when we talk about universal, that it is universally accessible, that because you might have a certain situation around finances, because you might have a certain circumstance around where you live in the state or your geography, because you have a certain circumstance around disability. For me, universal means that we've figured out how to address those issues. I'm hopeful that the conversations with the agencies and the legislature and the leaders across the state in education and early care and education and the advocacy groups that come forward around supporting our very important private providers in this state have a quality conversation and can try to find some common ground on these issues. But I don't know where this will be going specifically in reference to changes that we can anticipate. I have another question here. Do all teachers need to be licensed? And so the answer to that is no, not all pre-kindergarten teachers need to be licensed, but there needs to be a licensed educator on site for the 10 hours of pre-K that's happening. And that educator's responsibility is to ensure high quality connection to standards, to be involved in curriculum, and thinking carefully about quality in reference to the instruction and the support and the pre-kindergarten services that are taking place. So while licensure is not necessary for all of them, there is a requirement that there be a licensed teacher. I will say and we'll get into this too as we talk about professional licensure, that inside of the home providers, that there's a consultation model that's available that will change, that changes that standard. But certainly for centers and school districts, that licensure is required. There is a requirement to be connected to a licensed educator as a home-based provider. It looks a little bit different. And then I have one more question. How many children in Vermont are receiving 10 hours a week under Act 166? I actually don't have that information with me. So that's a great question for me to try to get back to you on. And those are the questions that we have. So I'm going to go ahead and move forward into the rest of the conversation. So the logistics of partnership between the school district and private providers is upfront, because I think that it is something that is a space or a source of some of the challenges that we have. So because we have, as I described, that statewide availability of choice of pre-kindergarten delivery, choice for parents, the enrollment process can be a little bit challenging for people to understand. So in the same way that a parent will enroll their child into a public school and have them attend that public school, and then if they move, they need to register with the new school district, that expectation continues to exist where you're accessing the public funds for pre-kindergarten, no matter where that happens. And so parents need to enroll their children, register their children with their school district. And if their residency moves, they need to enroll in the new school district. This is a place that seems to be fraught with confusion, because as a parent, and I understand this, as a parent, you're not thinking that you're going to your school district, you're thinking you're going to your pre-kindergarten. And so if you're in a private provider and you move your home, but you don't change your school, it might not occur to you, and it also might not occur to the private provider, that you actually need to enroll with the school district, with the new school district in which you're living. And that is something that I think has created a lot of challenge. It begs the question of what is this process that works best? And I think, I have heard some people talk about the concept of a centralized approach, that if you live in the state of Vermont, that you have a place where you get access and enroll, and does it really matter which school district you're in? But at the present time, and this moves into the next topic, all the financial processes regarding tuition happen at the local level. So in each school district, there is a line where we budget for the cost of the pre-K that we're providing. And in order for us to manage that within our budgetary process, we also count the children for whom we're paying for access to high quality pre-K, no matter where that happens. We need to count those children in our census. And so there is this sort of management process in the school district and with families and with all of these providers to try to make sure that we're counting students correctly, that we have all of the attendance information, that we have the residency verification for parents in the school district in which they live, regardless of where they're going to pre-K. And so you can understand maybe a little bit about how challenging that might be, with all the best intentions. There's also the logistics around agreements that are part of Act 166. When I mention agreements, what I'm talking about are the agreements between the private provider and the school district with whom they're partnering. Keep in mind that each private provider has to partner with the school district where each of the children live that are in their program. So before Act 166, and for a private provider who is not formally linked with a school district, they didn't really have to think a lot about where a child lived or whether a child moved. The parents paid the tuition to the private provider. The provider said, great. The parents brought the children to the pre-K provider. Fantastic. They're here, serve them, and they go home when the parent picks them up. Now there's a lot of sort of paperwork and management and reporting between the private providers and the public school systems. And a single provider might have anywhere from 5, 6, 7 different school districts that they might be partnering with. For example, in Chittenden County, we have 9 school districts pretty close together, which means that a private provider in Chittenden County could have a child based on where the parent worked from any of those school districts. And so those agreements are governed by the agreements serve the purpose to create a connection between the private provider and the public school system to make sure that everybody understands what their roles and responsibilities are. Those are important, and it is worth noting that a single private provider might have as many different agreements with different components to that agreement as they have school districts with whom they're partnering. We have, I think, across the state in many areas, worked to create common agreements so that private providers are not burdened by multiple different agreements, but that isn't necessarily true everywhere. And it's just something for people to be aware of. There are also specific insurance requirements that come with partnership. And for example, as a director for the Essex Westford School District, I expect to be on all of my partners' insurance riders as a noted party of their insurance coverage, so that any child that I send to a private provider is covered as a child who is receiving pre-K in that environment on behalf of the Essex Westford School District. It's worth remembering that the services that private providers are providing under public funds come with public responsibility. And that incorporates a great deal of different types of policy implementation and insurance expectations and following the rules. And so that is just another piece that is worth being aware of as you think about the logistics of partnership between private and public entities. There are also logistics around reporting and licensing, and we will get into that in a little bit more depth. I'll just stop and see if there are any questions on this particular topic. All right, I have a question here. Can parents get less than 10 hours if that's their preference? And there is the possibility of prorating funds and receiving less than 10 hours, but it is that can be variable across the school districts sometimes in reference to the way that that works and what it looks like. And if there's anyone listening that wants to consider prorating under 10 hours, I would encourage people to contact their school district directly to see what that looks like in reference to the partnership with that particular provider. I will say that what I'm watching as a director interacting in this environment is that I'm seeing more and more programs, private providers, private pre-kindergarten providers, do less and less of offering just the 10 hours. And so once you get beyond 10 hours, then you would access the 10 hours. I don't experience a lot of entities offering less than 10-hour slots. Do any of the rules, here's another question, do any of the rules or processes change if a child is under DCF care and living in a foster home? So this is a great question because the ESSA, which is the Every Student Succeeds Act, which is the federal law that was recently implemented, I'm not going to remember the year, it was within the past several years, has a new component to it that expects that any child in foster care has access to stay in their school in which they were prior to entry into the foster care system. And so what that means, and let me back up and add another piece of information actually. So in Vermont, under the residency statutes, children who are in foster care historically under residency statutes become the resident of the school district in which they're living in that foster home. So what that can sometimes mean, if we just take that for what it is we would say if a child goes from a home in one town to a foster home in another town, their school has to change. One of the reasons that there was a change in ESSA was to provide stability of school for children where the foster home changes, or they go into custody and change. And so one of the things, though, that comes with that is a reasonability standard. If a child moved from the Northeast Kingdom to Bennington, it wouldn't be reasonable to expect that child to travel the entire state of Vermont to go to school in the Northeast Kingdom when they're living down south. And so that is not what should happen for kids. But where it's feasible for children to stay put in reference to their public school provider, they should do so. Now, there's often questions about this in reference to pre-K. And again, from my perspective, what I will say is I think that it's imperative that we talk about what's good for children. I don't know if what I just talked about is applicable to pre-K or not. But I do think that any time that this issue comes up, it is worth contacting schools, having good conversations, bringing up that ESSA allows for this, talking to DCF, and thinking about this issue. Because what we know is where children change homes in those circumstances, it is good for them to stay stable in their school. And I would argue that that's applicable to their pre-K provider as well. All right, those are the questions we have so far. So I'm going to go ahead and move into an example of what it looks like to provide payment on the back end of these agreements. This is a complicated body of work, and it gives you an example of what it might look like for a school district to interact with a private provider in reference to the funding that is provided to that provider that is then expected to turn into 10 hours of free pre-K for the child that we're talking about. Each pre-K private provider needs to basically send an invoice to the school district about the children that they've served or will serve, and then we have an obligation to pay for it. And we pay directly to the private provider from the school district funds, and then it's expected that that transitions over into tuition reduction if the child is in a longer program than 10 hours, or actually no tuition at all if the child is only in 10 hours of pre-K. I do find that this has been confusing in implementation of 166, and there's been a fair amount of confusion about billing and billing parents and billing school districts and all of that kind of thing. So this just gives you an example on the school district side of things about expecting an invoice, the estimated payment from the district, the weeks that are covered for that payment, and you can see that we're paying up front so that parents should not be being billed for those 10 hours. This is an area that seems to sometimes get confusing for providers and families and school districts, but it is expected that that's the way we would do that. You can imagine if you owned a business and someone was asking you to do the work up front with all the materials that you needed and all of the services you were going to provide and all of the payroll that comes with it, and then they pay you afterward. That for private providers, I do not find that pre-K providers are making oodles of money providing pre-K in Vermont, right? This is all money that is paid for by parents typically. And so in the implementation of Act 166, we talked about the importance of making sure that private providers have access to the funds necessary to run their business while they provide public pre-K. But that's why you also see on June 5th, for example, an final invoice date and a reconciliation to make sure that the amount of money that has changed hands over the year matches the number of kids that have been in that program. And then there's an expectation that that money would transition to the parents through tuition reduction or no tuition at all if all they're receiving is 10 hours. I have a question here. Can and do pre-Ks bill more if they are providing special education services? So the entity responsible for implementation of special education is the school district. We are the only ones that would pay for special education services. If a school district got into an agreement, I would mention agreements earlier, with a private provider to provide the special education services on their behalf, then the school district would pay the provider, the private pre-K provider, for those services if they were providing them. I will share with everyone that that is not my experience about what's happening. My experience about what's happening is that, at least from where I sit and the work that I've done, is that public schools are offering opportunities for services, sometimes in the private pre-K, sometimes in the school district, and that it is the school district that tends to provide the special education services themselves. Keeping in mind that special education has a great deal of expectation around the qualifications of those people who deliver those services. Sometimes we contract with others to provide services on our behalf, and there are a lot of examples I could provide of that, but I have not found that to be particularly true within the context of pre-K. All right. We're now going to move to prequalification. Again, I'm sorry about the PowerPoint shifting. It happens when you send things over email and they show up on webinars. But I wanted to provide to you the pre-qualified pre-kindergarten education program status rule in front of you as I talk about pre-qualification. So pre-qualification is important because under Act 166, pre-qualification is required for private providers to provide public pre-K. Any private provider who is billing the school district under the process I just described is actually providing a public good, providing education, pre-kindergarten education, to the children in their program on behalf of the school district. And in order to be able to do that, you must be pre-qualified. I will also add that public schools also need to be pre-qualified to provide pre-K in our schools. And so this applies equally to private and public providers. The requirements include a quality standard, so there needs to either be national accreditation through NACE, a minimum number of stars that need to be found for the program within the Vermont Steps Ahead recognition system, so that we make sure that there's a level of quality. There is the possibility of having only 3 stars under the Vermont STARS system if there's an approved plan to move to 4 stars. I've provided at the end of this presentation a link to NACE as well as the STARS location. So if you have questions about the way that those are received by providers, both public and private, that you can take a look at that. There also needs to be an active license, and that is in good standing. And then there needs to be curriculum aligned with the Vermont Early Learning Standards. There's also professional program staff requirements that I've talked a little bit about already under another section of the law. So all providers under Act 166 need to submit a request to be pre-qualified, and that is approved through a review of these standards. And when a provider is pre-qualified, then the school district can go into agreement with them. School districts cannot provide money to private providers who are not pre-qualified. And so that's an important part of this process. On the Building Bright Futures website and under the AHS, the Agency of Human Services website, you can find the list of pre-qualified providers. And if you have a question about that link, I can provide it to you, but you can also just Google pre-qualification under Building Bright Futures in Vermont, and you'll be able to find that link. And you can look by community about how many pre-qualified providers might exist in any given community. I think that's a great way to know your own community, because then you'll understand how many slots are available under pre-qualified providers in your community. It will really help you to know kind of where things stand. I have a question. Can Montessori pre-K get pre-qualified? What about pre-Ks associated with churches? So that is a question that I didn't look up before I came to do this webinar today. I believe that if there is So I'm going to say this, but I want to just make sure that you know that you should double check this statement. I'm pretty sure that, for example, being inside of a church itself and providing pre-K is not going to create a challenge. But if you embed religious instruction within the context of the pre-K instruction that's being provided to children, you would probably run into an issue. So that separation of church and state is present, as it is anywhere else, and it's important that we don't use public funds to instruct in religious practices under the law. And so I think you could end up with some challenges if as part of it. I do know of pre-K providers who have their location in a church and are able to get pre-qualified and able to go ahead and go into arrangement with school district. I think it has more to do with the instructional piece. Any other questions before I move on from pre-qualification? All right, I don't see any coming in, but keep them coming. So professional licensure is also required. I talked a little bit about this already, but a reminder that teachers in each pre-kindergarten classroom in a district operated pre-kindergarten need to hold a valid license. So licensure in public school programs, pretty high. That's really, they need, if they're going to be the teacher, they need to be licensed. In private pre-qualified providers, we talked a little bit about the necessity of a center-based program to employ or contract for services of one teacher who holds a valid license with an endorsement that is applicable, that coincides with the hours of pre-kindergarten education paid for by the tuition from the districts. This is an area that has been a little bit confusing in implementation about whether or not the teacher needs to actually be present during the hours of the pre-K being provided. And the answer in centers is yes. And I also shared with you that there is a caveat for home providers that they can use that is not requiring a teacher to be present the whole time that pre-kindergarten is provided. And you can go and look on the links and go into the rules if you have interest in that. There is a requirement as part of the quality standards that there's good professional development. And I wanted to make sure to include that because while it's not specifically listed in the professional licensure component of the rules, it is a really intentional piece of the quality measures that are done under STARS and NACI. And so professional development that is ongoing for the professionals doing this work is really important. All right, so I'd like now to move into the policy conversation that I think is really important to have as we think about providing public pre-K in private providers and private through private environments. So the partnership under Act 166 between the school districts and the private providers is governed by the state of Vermont, the board's rules and practices. It's actually Rule 2600 if you want to look it up. There are comments about non-discrimination practices, making sure that the American with Disabilities Act is upheld. There are some pieces in the rules specifically to IDEA, which is the Individuals with Disability Act that governs special education, and at Section 504, which is about non-discriminatory access to education, that are mentioned within the rules. And it is expected that we need to be working together around this. There is, if you're interested in the interaction specifically around special education and 504 within the context of private pre-K, there is a webinar that's available about that on the Agency of Education's website and is worth watching if that's an area of deep interest for you. This is more of an overview about Act 166 and universal pre-K, but there may be some of you on the line here that have a deep interest in that. I think that this is, as I said earlier on in the webinar, I really think this is an area that deserves a little more focus and thought and conversation. It's particularly true in reference to children who are going to a pre-K provider that is geographically distant from their public school because their special educators are likely connected more so with their public school than some kind of pre-K placement that is 50 miles away where the parents work. And again, that's part of that equity conversation. There are policy implications around tracking attendance that you've heard me talking about. There's a great deal around data reporting. Background checks need to be completed where we're providing public service, and those background checks need to meet a certain standard. A private entity has less access to background checking information, for example, than a school district does. And so the Agency of Education and the Agency of Human Services a couple of years ago really had to come together and figure out how to address the background checks that are so critically important to be at the level under the school district standards if we're providing public pre-K inside of private providers. So that's another policy impact that is just worth noting. I'm going to stop there. Looking at time, we only have about 10 minutes left. I want to make sure that if there are any particular questions around policy that I see those. So I'll give you just a moment. All right, I'm going to move forward. Doesn't look like there's any questions just right this moment, but we'll have some time for questions at the end as well. So I wanted to engage you a little bit around licensing violations and change in pre-qualification status. So there is a clear expectation that any time there are changes in the status of staffing, for example, if a center loses its licensed teacher, those conversations need to take place not only with the school districts with whom that center is partnering, but also with the agencies. There's some expectations around that. Changes in accreditation that impact pre-qualification status need to follow that same process. Licensing violations are also important to pay attention to. There is an interesting conversation happening right now about private providers who have a significant violation in their licensing. So licensors from the Agency of Human Services come around to all pre-K providers and do checks, which I think is great. And sometimes they find something or something gets reported and there's a violation. Part of the question we're talking about now is how that relates to pre-qualification. So a school district's ability to partner with a private provider is situated in law under the pre-qualification. So if a provider is pre-qualified, it gives us access to partner. If there's a significant licensing violation, I think the question starts to be, does that or doesn't it impact the pre-qualification? And also, what does that mean about the agreements and what standards do we hold? And are there certain violations that a school district might no longer be comfortable partnering with a private provider? So those are some of the examples of the kinds of things that are happening that we continue to struggle with in implementation and thinking about all of this as it really comes to fruition. There are some clear expectations around suspension and expulsion reporting from private pre-K providers to the public schools that they're serving. We take discipline very, very seriously in public settings. It's important that discrimination does not happen under the context of suspension and expulsion. Private providers historically have had the right to tell families that they're no longer going to serve a child. They continue to have that right, but there are some new requirements around that if you're providing public pre-K, because the public conversation about suspension and expulsion really needs to ensure that there are not violations around disability or other issues that are taking place around policy expectations. And then also I see pretty frequently inside of the agreements with school districts that there's an expectation that the public school officials can visit the public provision of pre-K and private providers based on their determination of needing to do so. So those all feel like important conversations for you to be aware of. Instruction and assessment. We've talked a little bit about the Vermont Early Learning Standards as a critical part of making sure that standards are being embedded within the instruction. High quality pre-kindergarten providers assess themselves around both standards and instruction through either NACCE or the STARS process that we've talked about. There's a fair amount of assessment around curriculum within the context of those quality measures. It's also worth noting that all the way across the state, Teaching Strategies Gold is the assessment that gets used to monitor the progress of young children in their learning through the public provision of pre-K. That's true in our public schools. It's true in our private providers. There's a statewide system that monitors kids across a number of different areas of functioning and performance that are aligned with the standards, the Vermont Early Learning Standards. And so that all comes together to be the instruction and assessment expectation that's in place in pre-kindergarten. If there are any parents out there that are having experiences in their pre-K and they want to think about how that's going, you can go look at the Vermont Early Learning Standards. You can go look at Teaching Strategies Gold, and then you can think about the experience that your child is having and be able to have a good conversation with within parent-teacher conferences with your pre-kindergarten provider as you think about what you're hopeful for. Also, pre-kindergarten providers are assessing children, and so that information is available. One of the things we do in our school district is when we go ahead and pay for all of these services in a private provider, we ask for a copy of the 3- and 4-year-old years of that child's Teaching Strategies Goal, and we give that to their kindergarten teacher. And it gives the kindergarten teachers a really robust understanding of how they've performed in their pre-kindergarten experience in relationship to the standards, and helps our teachers better know our children and thinking about our kindergarteners and where they're coming in and what their experiences have been and where their strengths are and where they might have areas of need. So those are the areas that I wanted to cover, and I wanted to end by sharing some thoughts about the strengths and challenges that presently exist inside of the partnerships that are happening in pre-K around the state. I really do think there's a strength and expansion of options for young children in gaining access to high quality pre-kindergarten, and I think that's true under Act 166. I think there has been an expansion of geographic options for families, given that it is statewide. I think that there's a lot of relationship that has been developed between school districts and private providers. And I will give you the other side of that in a moment, because I think the relationships are great, but I think there's something that's challenging about trying to have relationships with 42 providers as a single school district, which are the number that we have in the Essex Westford School District. The collaborative groups between early learning providers and school districts that are cropping up in Chittenden County. We have the Early Learning Partnership that all the providers and the school districts are a part of. I think that's a real strength. And then shared professional development across the private providers and public schools are also a strength. I do think there are some challenges, and you've heard me talk about a couple of them, but I'll share that I do think that communication and understanding of this process is challenging. I think that's why Secretary French spoke to some of the need for change. Changes in status that I talked about in reference to pre-qualification are a challenge, so trying to monitor all of the providers and make sure they're following all of these rules is very difficult to do. Policy implementation in a consistent way across 42 providers for the Essex Westford School District's provision of early childhood education for pre-K is sometimes hard. The tuition process that I talked about and all of the reimbursements and the arrangements can be challenging. There's a great deal of duplication of effort that's taking place right now under Act 166 when you think about it, given the number of agreements that each private provider needs to have with each public school district, as well as all of the enrollment processes and tuitioning and all of that. And then near and dear to my heart, and I think most importantly, we need to talk about the equity challenges that presently exist under Act 166, specifically around socioeconomic differences and variation for our families, as well as the issue of access to services to serve children who are experiencing developmental delays. So those are the pieces that I see. I wanted to provide you access to some resources so you had them. You can also probably do your own searches of the internet of any of the vocabulary that I used in this presentation to find more information. And we have just a couple of moments for questions. So let me just take a look here. Is there any tracking on Act 166 outcomes? For example, do children who receive services under Act 166 show increased readiness for kindergarten? Can we learn from other states who have implemented a similar program? So I always think that it's important to learn from others who have come before you. And yeah, I think there's definitely access to other states who have been doing a variety of different, who've been taking a variety of different approaches with pre-kindergarten that we can learn from, certainly. I don't have any one particular one in mind at the moment to cite, but I think the answer to that is yes. And then in reference to Act 166 outcomes, there has been a great number of attempts to measure kindergarten readiness and try to figure out whether or not implementation of pre-K is making a difference. I think that there has been some success in that, but what I would say is that we have a lot of research nationally that tells us clearly that where children experience high quality pre-kindergarten, that it makes a difference. And so if we monitor the number of children who are having access to high quality pre-K based on our assessment of the quality of the pre-K that's happening for them, then we should hit that mark. I have not seen a large review of all of the Teaching Strategies Gold information to date from that perspective. I wonder out loud if that's possible. I don't know, but it's worth a conversation. And then certainly there is a kindergarten readiness assessment that is done statewide by kindergarten teachers of children who are coming in. So we do have some data sources. I'm sure that the Agency of Education has done some work on this. I don't want to speak for them, and that question is definitely worth posing to them. I have one more question here. Who should a parent contact to learn about and apply for universal pre-K? What if they are concerned that their child has a disability or a developmental delay? So if you are interested in universal pre-K access, I would encourage you to contact your school district, and you will find who to contact about that by looking at the website. If you cannot find the specific person you need to call, then you could just call the main number, explain what you're looking for, that you would like to speak with somebody about universal pre-K, and then they will look to contact you back. And it is very important that if any parents are concerned about their child having a disability or a developmental delay, that you do that same thing, that you contact the school district. They have an obligation to respond to you and have a conversation about whether or not there's a concern. Thanks so much for being here with me today. It's been great to be here, and enjoy the rest of your day.
Yeah, I just want to remind everybody that you're going to find this website. We save it on our own website, which is vermontfamilynetwork.org. And we also have a YouTube channel that you just Google Vermont Family Network. On our website, you'll find a list of the upcoming webinar that I mentioned. We have lots and lots of other resources. And certainly we'd love to talk with anybody who has any questions. Our toll-free number is 1-800-800-4005. Have a great day.